You could say, well, 30 million more people are going to go into the insurance market. Why wouldn't they want more people?
Because they are greedy, profit-driven, profit-before people-oriented companies.
And also, they are able to pick right now.
Exactly.
I want to talk a little bit about something else that stops right away, and that's the practice, perhaps the meanest of all the insurance company practices. This is called rescission, which in plain English means canceling your health insurance when you get sick. And we had testimony in our committee from a woman who had been a nurse most of her working life. She was now in her 50s, and she left nursing to start kind of another career, went out on the private market and bought insurance that she could afford, thought it covered everything she needed, and then she was diagnosed with very aggressive breast cancer. And she went to her insurance company, she got scheduled for the surgery. The Friday before the Monday of her surgery, her name is Robin Baton, I'll never forget her, because we adjourned the committee for 5 minutes while she got herself together, and she said that on that Friday they called her and said, "I'm sorry, we went back in your medical records and what we found is something on there that says that you had a pre-existing condition." And do you know what it was? There were two things. One was acne, that of course could lead to some sort of a cancer cell, they said. That she had lied about that. She didn't even remember that.
She must have been a teenager at that time.
And the other was that she had misstated her weight, understated her weight. Now, I make a little joke like, what woman hasn't? You know, you have an accident and people look at the driver's license and say, who is this woman? You know, she's not 120 pounds. Anyway, and so she was out of luck. She spent the next 9 months looking for health care. Finally, actually, it was her congressman who convinced the insurance company to do it, and by that time, the cancer had progressed and was in her lymph nodes. Yeah. And so, you know, she was much sicker. That policy of rescission will end on day one. I see that we've been joined by someone else, Keith Ellison, representative from Minnesota, and I'm happy to turn it over to you. How time flies.
Well, to my extreme embarrassment, we're out of time. Support health care. Congressman from California, thank you very much, Mr. Garamendi.